As we look to the future of healthcare in this country, partnerships are becoming essential to financial and organizational success. In the new payment models, providers are responsible for the comprehensive healthcare of defined groups of individuals. The goals of the new health models are to provide excellent customer service and medical care, improve the health of the population and lower the cost of services. If successful, healthizations will be rewarded financially and market share. If unsuccessful, they'll lose money and conceivably be forced out of business. This Darwinian approach is shocking to many, as healthcare has not traditionally been seen as ultra-competitive, but the new imperative to lower costs is driving non-traditional partnerships designed to maximize value for businesses and consumers. Actually, Darwin didn't say that the strongest of the species would survive. He predicted instead that those that were most adaptable to change would survive. In that regard, the healthcare industry is in the midst of profound change, and it's becoming clear that the organizations that adapt to the changing circumstances most successfully will survive and prosper. Partnerships become key to the new healthcare models, partially because change is occurring so rapidly that traditional mergers are taking too long to implement. Health-related organizations like Aetna are recognizing the value of retail clinics located in pharmacy chains like CVS and find it easier to partner with these industry leaders rather than create their own retail clinics. It's also been reported that United Health and Walgreens are planning a partnership to open urgent care centers in pharmacies in at least 4 states. Similarly, healthcare organizations, instead of creating their own insurance products, may find it more expedient to partner with a major health insurance carrier, like United Health Group, and create a co-sponsored health plan. Insurance companies need healthcare providers, and rather than stand between the providers and the patients, some of the major insurers are forging more collaborative relationships with providers. The resultant insurance products are being co-branded and marketed as a joint product. The benefits to businesses and patients, in terms of savings and quality improvement, are still too early to determine. What is clear is that the healthcare delivery system is shifting rapidly to large collaborative delivery models designed to achieve these goals. Aetna CEO Mark Bertolini told investors recently his organization's partnership with CVS is a benefit for the consumer. The experience the customer gets is really about a patient-centered medical home model, where we're supporting interaction with the medical community, preparing people for appropriate compliance, preparing them for their visits, setting up appointments, eliminating prior authorization, doing all sorts of things to help navigate the system for them. Bottom line, healthcare providers and payers are joining forces for some of the same reasons they have in the past: market share and negotiating discounts through collective volume. Being bigger also makes it possible to compete for contracts that ensure large employers. As healthcare consolidation and new partnerships play out in cities like Duluth and Minneapolis, it will be important to consider their impact on vulnerable people and safety net health providers in rural communities. Terry Hill is Senior Advisor for Rural Health Leadership and Policy at the Duluth-based National Rural Health Resource Center, and he teaches management and leadership for the MBA program at the College of St. Scholastica. He can be reached at bill@ruralcenter.org.